we will be onboarding individual clinics to be ready to be able to assist us with vaccinating the phase 1B population, which right now is those with multiple comorbid conditions. And so right now we're finishing up onboarding the hospitals. Then we'll be moving to pharmacies, especially those pharmacies that can assist with long-term care facility vaccination. And then we'll be moving to large medical facilities and FQHC and safety net clinics. So probably sometime late January, we should be able to get those clinics onboarded. So I'm seeing another question that asks, how do people with comorbidities identify themselves at the health departments? So it's really an honor system. There isn't a way for us to verify if someone truly has 2 or more comorbid conditions. We could verify age with a driver's license, but there's not really a desire to police this. So we hope that people will come and ask for vaccine if they meet the criteria for the phases that we're in. If people show up and they don't, we will remind them that the priority is for whichever phase we're in at the time, but there isn't a requirement for a physician's note or prescription or any kind of health record check in order to get the vaccine. Next question is, how long does a previously positive individual need to wait before getting vaccine? The positivity in itself doesn't matter as far as it's not a contraindication to getting the vaccine. So regardless of COVID history, as long as you're not acutely ill with COVID, you can get a vaccine. If an individual who had been previously diagnosed with COVID-19 is within 90 days of that diagnosis, they may choose to defer until closer to the end of that 90-day period to allow people who may be at higher risk to receive vaccine before them. But that's not a requirement, and there's no contraindication to getting the vaccine. Someone's asking, do we have an estimate on when organizations who applied to be providers, and it says parenthetically 1A2, may hear back? So for the 1A2 population, which is the outpatient medicine population for outpatient medical providers, most of those vaccines are going to happen at health department pods or potentially through local pharmacies. We're also working to onboard the very large practices in the state that have more than 100 staff members. But for smaller practices, you probably will not be vaccinating yourselves, but going to a local health department opportunity or some other opportunity in the community to be able to receive vaccine. We'll be onboarding the providers, like providers' offices, in order to be able to help vaccinate the 1B population of older, sicker folks, or when we move into general public. Someone's asking if someone had multiple anaphylactic reactions to alpha-gal, can they receive the vaccine? So the answer is yes, they can receive the vaccine. They need to receive the vaccine in a medical environment or someone would be able to respond appropriately to an anaphylactic reaction. And they need to be observed for 30 minutes after administration of the vaccine. But the only contraindication to receiving the vaccine is if you're someone who has a known history of anaphylaxis to a component of the vaccine. If you have allergies to other things, whether that be food or pets or environment, you should also wait for 30 minutes after you receive the vaccine and get vaccinated in an environment that can be able to respond appropriately to an anaphylactic reaction, but it is not a contraindication to getting it. So the vaccines that are being sent to health departments are for the phase 1A population. So that is frontline healthcare workers in hospitals, first responders, those individuals who provide in-home healthcare services, the healthcare providers that are in schools and universities, um, and the staff of long-term care facilities if they are not anticipating being vaccinated through the federal partnership. So there's a fairly wide net of folks who are able to go to the health departments. And those local health departments have been communicating with those agencies and facilities on the local level to make sure that they're aware of when and where they need to come to get vaccine. Someone's saying, I'm an outpatient private practice doctor who sees and swabs for COVID every day, but don't have access to the vaccine through work. How do I get this through the health department? So the reason that the hospital providers are put just ahead of the outpatient providers is because of the need to protect the hospital infrastructure. And we all know that the hospitals are all at capacity. And they are working with these patients all day, all night, every day. So the outpatient medical providers will come right after we get the hospitals done to be able to preserve the infrastructure and make sure that sick people have a hospital to go to. And then we'll be communicating when those pods will stand up to be able to vaccinate the outpatient providers. So you'll get it most likely through your local health department, and we'll be communicating that out so that you know when to go. We will beginning today start sending out TNHONs to the Tennessee Health Alert Network. And these will be just very brief, bulleted, kind of what to expect over the coming weeks. Informational resources that'll come out on Friday afternoons. And that goes to the email that you have with licensure. So if you're not sure if your email may have changed, or if you may have the wrong email with licensure, you may want to go online and make sure that your email address is correct so that you get those alerts. We'll also be sharing those with the medical societies like THA and TMA and TNAP and others, so that they can also send those out to their membership, also with the Pharmacy Association. But we'll start communicating that. So when we do start moving to other phases, you should be able to get those updates on Fridays and know what's coming to the week ahead. So someone's asking, do safety net clinics staff show up on an invitation list, or do you have to apply individually? So I'm assuming that you're talking about getting them vaccinated. So the safety net clinic staff will fall into phase 1A2, so outpatient staff, and that will be communicated when your local health department is ready to do that. If you want to sign up as a safety net clinic to be able to provide vaccine to patients, then you'll need to go to our website and begin completing the CDC's provider agreement so that we can start you along that process of being able to onboard. We can only send vaccine to facilities that have fully onboarded to the process of having the CDC provider agreement completed and signed, tennis functionality or capability, and making sure that they have appropriate storage and handling to be able to handle these vaccines in the environments that they need to be stored in. So you have to do that first, and then those outpatient clinics we will start allocating vaccine to when we move into phase 1B, which will be the most likely the chronically ill and older population. Someone is asking, how do I follow up to assure that the correct person is on the profile as the vaccine coordinator? Because they've not been getting communications. So actually, I'm going to defer that to someone who's in the room who can jump on and comment about that if they're
Hey, Dr. Fiskus, this is Liz. I can take care of this one.
Thanks, Liz.
Holly, I will reach out to you personally.
Great, that's easy. Yeah, so there's several questions about 1A2 staff. So again, the first priority is to vaccinate the people who are in the hospitals, phase 1A1. There's about 450,000 of those individuals, and so far we have about 56,000 doses of vaccines. So we will be onboarding clinics to be able to vaccinate the public. The providers who are in outpatient clinics will most likely be vaccinated through their local health departments, and we will let you know when that phase opens and when you can start sending your providers there. So I know there's a lot of anxiety and excitement, which is great, about getting vaccine, but we don't have enough to cover the inpatient population first, which is the first priority. Then we will move to outpatient, and we promise we will clearly communicate that when we are ready to let you know where to go to get those vaccines. Someone's asking, what's the latest guidance on if you don't get your second dose at the right time frame? So for the Pfizer vaccine, the most recent guidance is you can get it as early as day 17. They would like you to have it on or around day 21, with the kind of the outside being day 23 as optimal. But you get it when you can get it. If you come after day 23, they're going to give you the dose of vaccine. There's no indication right now to repeat the vaccine. It's probably going to be fine. We don't have to revaccinate anyone for any other series of vaccines that we do if they don't meet the second or third dose in the time frame when we would like them to. So we don't expect that there'll be a problem with this one, but it hasn't been studied yet to see what happens if you're months out from when you were supposed to get it. But the recommendation is that you go ahead and send them on to get vaccinated, and we will do that. The vaccine monitoring app is ready. So if you have gotten a vaccine or you're going to get a vaccine, go on to VSafe, letter V, the word safe. And actually, I haven't checked it out myself, but I think it's just, I think you can just Google it online and sign up for that. You'll get text alerts that ask you every day how you're feeling, where you can respond to that and put in symptoms. And it's a good real-time surveillance system that they've set up that's going to have data on millions and millions of people very, very quickly. So do check that out if you're getting vaccinated. We very much suggest that you enroll in VSafe to be able to do that. Plus, VSafe will also remind you when your second dose is due, which is also nice. Are there contraindications to individuals who are immunosuppressed? No, there are not any contraindications to getting the vaccine. And in fact, we know that these folks are at higher risk of significant disease from COVID-19, so we would recommend that they do get vaccinated. The one thing that we don't know is if the vaccine will be as effective in that population as in the population that has a normally functioning immune system. But they should go ahead and get vaccinated. It will surely have some impact, and something is better than nothing. So even if they have immunosuppressive medications, if they're on chronic steroids, they can still get vaccinated. As a reminder, there's no virus in these vaccines. You don't have to worry about them getting ill because they were immunosuppressed. Is there a way for long-term care facilities to require employees to be vaccinated or have to wear a mask? So you can certainly require your employees as a condition of employment to wear a mask. I would suggest that you talk to your attorney about that before making those kinds of mandates. You, by law, may require employees to be vaccinated. The problem with that is right now there's not vaccine available to everyone, so we really discourage employers from requiring the vaccine when it is in short supply, because there's not really a way to enforce that if the vaccine's not available. And then the the second is that it's under emergency use authorization. So while we have data on tens of thousands of individuals, we don't have data on millions of individuals. And so it's possible that, there could be a 1 in a million type of reaction that we're not aware of yet, which, might give one pause to mandate the vaccine until we have it in a larger population. Sorry, my scroll went up to the top, so I'm gonna get back to where I was. Okay. Is more vaccine, either Pfizer or Moderna, expected before the 21-28 day second dose distribution? In other words, are we going to be able to move forward? So we're still getting clarity on this. We know that there's additional Pfizer vaccine that is available. What we're not sure of is if that is for the second dose or whether we should go ahead and allocate this out, and then there will be another shipment for the second dose. So we're getting clarity on that for the Pfizer. The Moderna vaccine, that shipment that comes the week of the 28th, we are not sure if there will be another shipment of that between the 28th and when the second dose shipment comes. So that's a very long answer to say we don't quite know yet. There's a question about contact tracing, and we're not the contact tracing team, so I hesitate to give you an answer about contact tracing in this forum, but we can pass that on to our folks that do contact tracing. If you want to put your email in the chat, we can get back to you about that. So there's a follow-up question, says that those who can't get live attenuated vaccine should not get this vaccine. We've not heard that anywhere, that those who can't get live attenuated vaccine should not get this vaccine. The ACIP guidance is that individuals who are immunocompromised should get the vaccine. What we don't know is if it will be as effective as if you were not immunocompromised. If staff who are 1A1 choose not to be vaccinated at this time, when can they expect another chance to get it? That is a really good question and will probably be somewhat facility dependent. Depending on where you work and who's administering your vaccine, there may be a sign-up process for doing that, and depending on how far down the road they are in that sign-up process, there could be a delay where you're not necessarily able to get right back into line. So I would check with whoever it is that is providing the vaccine for you and find out what they think the next opportunity is going to be to get that vaccine. Anticipated time frame for being able to vaccinate kids under the age of 12. So the Pfizer vaccine is currently approved for children down to age 16. They do have 12-year-olds in the trial, and so they will have to get to whatever their number is that they're shooting for to feel like they've studied that population. And then those individuals, 50% of them have to get at least 2 months beyond the date of their second dose of vaccine. So I believe they started enrolling the 12-year-olds in maybe early November. So then their second dose would be early December, and then 2 months after that would be early February. And they have to get enough of a number in there. So maybe March at the soonest. And then, of course, ACIP will have to reconvene. They'll have to submit a new emergency use authorization to include children down to that age. So I wouldn't look for it before spring. Okay. There is a caution about pre-treatment with Tylenol or NSAIDs, but what about holding regular meds like meloxicam? Yeah, good question. So the question for those of you who aren't familiar, there have been questions about whether or not you should consider pre-treating before getting the vaccine to maybe attenuate the possibility that there would be fever or body aches and the like. And the recommendation is not to do that because there is that there could be some attenuation of the immune response to the vaccine if you do that. So if you use anti-inflammatory medications, and then you give the vaccine and what you want is an inflammatory response, then what we don't know is if it would impact the way the body reacts to the vaccine, and if maybe you wouldn't get as good of protection as if you had not treated. So it would make sense that if individuals who are on chronic medications that are anti-inflammatory like meloxicam are able to hold that vaccine for a few days before they go get vaccinated, it's probably reasonable to do that. But if it's something where it's going to significantly impact the quality of their life to withhold that medication, then most likely they would be advised to just go ahead with it. Should coronavirus vaccine not be administered at the same time as a live vaccine, or does 28 days, the 28-day in-between rule come in? So they are currently recommending that there be at least 14 days between coronavirus vaccine and any other vaccine, live virus or not. And initially there had been thoughts that, oh, you could probably administer flu and COVID at the same time. Now they're saying that they really recommend that you put 14 days between those shots at a minimum. So the live virus part doesn't matter. It's just the spacing with the COVID vaccine. All right. Is there a way to sign up healthcare workers who are not considered frontline and may not work within a hospital in order to ensure they are within earlier groups of vaccine recipients? So there is no sign up per se. You might see through facilities or through county health departments that they might deploy a sign up for pods just to be able to make sure that they don't have people waiting in lines when they don't have enough vaccine to get to everyone. So I would look for local communications about that. There's nothing on the state level or any kind of registry to put people into. We are expecting that there will be a phase finder tool that's on the Tennessee government's COVID-19 resource page, where you would be able to go in and put in your information, and it would tell you what phase you come into. And then when your county moves into that phase, it would remind you that or send you an alert that your phase is open. So I would look for that as well. But right now, there is no other central way to get anyone on a list. Okay. What are your thoughts on what to do if your second dose comes due when you're sick with COVID? So many of the symptoms linger for weeks. When are you recovered enough? So they consider you recovered enough when you're through the acute phase. So you're no longer having the fever, body aches, chills, myalgias, the just acutely feeling yucky part. If you have lingering cough or lingering loss of smell or taste, that would not prevent you from getting a vaccine. So, it's probably reasonable to at least wait a couple of weeks beyond when you get your acute COVID-19 diagnosis, and then go ahead and get your vaccine, a little bit late for your second dose. Is there information for patients or staff of specific ethnic groups to help those who are reluctant to get vaccine as education to understand that they are higher risk and therefore of greater benefit from vaccine? So that's a great and really important question. So we are building resources on our resource page. We're also working with surrogates who can go out to their local communities and talk about vaccines. We have a very large stakeholder group, as Liz mentioned at the top of the call, including our Office of Minority Health and Disparities Elimination, that work with other organizations like the Minority Health Task Force, where we've given messaging and where we're working to have people who are the right people to deliver the messages to the right populations do that work. So we're working on identifying who those message carriers can be, and certainly if you have recommendations for that, we would be happy to hear about them and connect with them so that they can assist us in getting those messages out. In Memphis, there's a form for other workers in the event that there's vaccine left over in the first few phases. Yeah, so we have recommended that facilities that have vaccine put together a volunteer list to vaccinate people who are out of phase. And so what that means is if they're vaccinating all day long and Pfizer vaccine comes in a 5-dose vial, Moderna vaccine comes in a 10-dose vial. Let's say they run out of people and they still have 4 doses left in a vial. We don't want those 4 doses to go to waste. So we've encouraged facilities to have a volunteer sign up where these individuals have volunteered to kind of be a last minute notice that, hey, we've got 4 doses of vaccine left over. If you can come right here, right now, we can give that to you and vaccinate out of phase. So we have fondly referred to this as kind of the day-old donuts approach to vaccine, in that we don't want to throw anything out at the end of the day. So we would rather put leftover doses that are going to be discarded into arms that are out of phase than to put it into a Sharps container or destroy it. So there may be an opportunity if you work in a facility to sign up to be able to get those end of the day doses to make sure that that they get used up. How do we amend our provider application? We're in a better position to receive vaccine now than when we first submitted. That's great. If you, Adam, if you want to put your email in the chat, we will follow up with you directly. And then as far as helping us to identify surrogates to provide messaging, you can message that to VPDIP. That's Victor Paul. Okay, I'm not going to be able to do this. V is in Victor, P is in Paul, D is in David, I is in Indigo, P is in Paul, VPDIP. .pandemic@tn.gov if you want to send your list of suggestions there, and contact information if you have it. Otherwise, I don't know how we'll find them. We would love to be able to reach out to them and help give them the messaging so that they can go out and help us spread that message. Should a small practice space out when their staff gets vaccine, or are best to get vaccinated all at once to stay on the same vaccine schedule? So there is some chance that there will be enough yuckiness after getting the vaccine that some people may end up calling out from work. It's not as much of a concern with the first dose as it is with the second. It's not as much of a concern with the Pfizer as it is with the Moderna, and it's not as much of a concern in older people than it is in younger people. So I think the Pfizer numbers were something like 3% of individuals had headache and fatigue that lasted a couple days or so. That was the most common side effect. The Moderna vaccine is a little more likely to give you fever that might keep you out of work. So if you're a small practice, it would be a good idea to space your folks out so that you don't have all of your nurses or all of your admin staff out at one time, but maybe have a little bit of each. Or if it's a practice where you're closed on a given day or a weekend, try to arrange it for a Friday so that that you don't wipe yourselves out. You certainly shouldn't expect to see 100% of your people out because of the vaccine. All right, I think that is all the questions we've received. So last call for questions. We've got a couple of folks that we're going to follow up with specifically. Oh, okay, here's another one. What about another, hang on, my scroll things give me fits. Okay, that's not the one. Okay, when will these slides and video be available online? We will have Usually we can get those posted by Monday. So look at the same place where you register for these webinars, and that should be posted there hopefully by first of the week. What about another vaccine given 14 days before coronavirus vaccine? Is that okay? Or would coronavirus vaccine be pushed out? Yeah, as long as you've got 14 days between your vaccines, that's fine. And if you inadvertently were to give a vaccine within 14 days of another vaccine, neither of them need to be repeated. I really think the concern here is they want to try to keep the data clean on the COVID vaccines. And so, let's say you got MMR vaccine, and then right after that, you got COVID vaccine, and then you broke out with the rash that you get with MMR vaccine. Was the rash due to the MMR vaccine, or was it due to the COVID vaccine? So I really think that's why they want to keep the spacing. It's not because of efficacy or any danger in having them near each other, but probably more just around surveillance of symptoms after vaccination. Okay, someone wants me to go over the Tylenol thing again. So knowing going into the vaccine that there's a decent chance that you're going to experience some local injection site pain, swelling, discomfort, maybe fever, maybe headache, maybe muscle aches. The question has come up, well, should I pre-treat myself before I go get the vaccine to try to ward that off from happening? And the answer is no, you should not, because the way vaccines work is by causing basically an inflammatory response. So you want your body to have some inflammatory response to create the antibodies that you need to be able to protect you. So it's fine to take those medications if you need to for comfort afterwards, but we don't want to pre-treat everyone because they may not need these vaccines, and it's possible that it could affect the way that that your vaccine works for you. So if you need to take Tylenol or Motrin after vaccine because you're not feeling well, you can do that. The recommendation is that you not do it in advance to try to prevent symptoms that you might not have. So hopefully that makes sense. Oh, can you give information about the monitoring app again? Yes, so it's called vSafe, V like Victor, safe, the word safe, S-A-F-E. And I think if you just Google that, and Liz can jump in if there's a better way to do it or a specific link, but you sign up for vSafe and you put in your cell phone number, and then it texts you every day. You tell it that you got the vaccine. It sends you a text every day, and you give feedback about how you're feeling. And that's just another way to be able to do surveillance to see what's happening as people get vaccine, so that as we start to get millions of people getting vaccine, we might be able to detect some signals if there's anything that's happening on a very, very rare kind of event. That app will also notify you when your second dose is due, so that you know when to go in and get that and you don't forget. And then the other thing I'll mention eventually is you can't see all sites now, but there is Vaccine Finder that you can go onto as well that will tell you, you can put in your zip code and it will tell you who around you has vaccine that you would be able to get and which vaccines they are. Remember that when you get the vaccine, you have to get the same manufacturer for both doses. So once we get to vaccinating the public and there's vaccine widely available, you can send people to Vaccine Finder. They'll be able to go on and see that, okay, my local Walgreens has the Pfizer vaccine that I need, and then be able to know where to go from that. Okay, and the email address is vsafe.cdc.gov, because apparently Googling does not work. So vsafe.cdc.gov will get you to the vSafe site to sign up. Thank you, Pam Delosier, for putting that in. All right, we got about 10 minutes left. Let's see if any more questions come in the next minute or so. And folks in the room, let me know if I missed anything.
Dr. Fiskus, we don't see anything that you've missed. Thank you.
Someone's asking, are there QR codes for the VSafe app? There are posters that are out for VSafe. I don't know if they have QR codes on them or not. Liz, do you know?
Hi, they do. The flyers that are available have the barcode on them for you to scan. And they're on the CDC website. If you go to the website, you can download them and print them.
Thanks, Christy. All right. Oh, okay. A couple more. You said health departments are getting vaccine earlier than pandemic providers. What's the timeline for the pandemic providers to get vaccine? So I'm assuming that we're referring to hospitals, smaller hospitals. So the hospitals that have not received Pfizer vaccine, if they are onboarded to be able to receive vaccine, they will get an allocation of Moderna vaccine that should arrive December 28, 29, or 30th, and we'll communicate that directly to those facilities when we know that information. There is some limited amount of vaccine that will arrive in the health departments this coming week, December 21, 22, 23, and some of that vaccine will likely be distributed to some of the smaller hospitals. We're in the process of looking through that and figuring out the logistics of that. So more to come. We will communicate directly with those hospitals when we determine that, which will probably be over the weekend. COVID vaccination should be completely free for all individuals. Yes, that is a true statement. So providers can charge for an administration fee. They can charge insurance for the administration fee. They cannot pass that charge through to the patients, and there is no charge for the vaccine itself because it is provided at no charge to them through the federal government. So no one should be paying out of pocket for this vaccine. And when is it likely that the vaccine will become available to the public at large? That's a very tricky crystal ball question to answer. So if we don't get any more vaccines online besides Pfizer and Moderna, and if they only ramp up to the degree that we're being told that they are going to ramp up in January, we could expect to have 100% of the population vaccinated by the spring, probably May of 2022. That's obviously a very long way away. We know that there won't be 100% uptake of these vaccines, and 100% of people won't be eligible. For example, young children may be quite some time before they can get it. We think, given the expectations that we're told to have of Pfizer and Moderna, we can probably have about 70% of the population immunized by August, and about half immunized by probably May or June. So I would look for publicly available vaccine sometime late spring, early summer. I don't think it'll be earlier than that unless we suddenly get a big bolus of some of these other vaccines online. We've been told by CDC that we may not see some of these others come online just because of the efficacy of the vaccines that are coming down the road not being as good as the first two. It makes it a little hard to approve a vaccine for use that has 70% efficacy if the ones that you have in circulation have 95% efficacy. And you can argue both ways on that isn't 75 or 70% better than nothing. It definitely is, and it could still get us towards the goal of herd immunity but it's also difficult to, and it has never been the practice of the FDA to approve products that are inferior to products that are already being used. So more to that on that to come, but the way we've calculated that is assuming that we may not get other vaccines besides the Pfizer and the Moderna vaccines. All right, 4 minutes to go. I'm not seeing any other questions. Last call. I will turn you loose. We will not have this call for the next 2 Fridays because of one of them is Christmas Day and the other one is New Year's Day. So we'll plan to regroup, what will that be, the 8th of January at noon Central, 1 Eastern, but we will begin sending out Friday Tianhans for the Health Alert Network. First one will come out this afternoon. We probably won't send it out on Friday next week, but maybe look for one on Wednesday of next week and then Wednesday the following week. And those will be very short, not like the last one that you would have received, but very short, bulleted. This is what to expect over the next week. This is where we are. This is the progress that we've made, kind of notifications to help you answer those questions and help you be able to answer questions that your patients are asking of you. So look for those communications. And community products that are being developed are located on the public part of the website. So if you go to tan.gov/health, click the yellow bar, go to the blue COVID vaccine tile. Whenever we publish a one-pager for the public, we put it up there on that site. So you can look for those. Oh, and then I saw someone asked about IVIG. So yeah, thanks for bringing that up. So if you have patients that get monoclonal antibody, and I assume IVIG would be included in this as well, although they haven't specifically stated it. They've specifically stated monoclonal antibody. If you have a patient who, so they were COVID-19 positive, they received monoclonal antibody infusion, they should wait 90 days before they get a vaccine. And, kind of makes sense because they should have antibody because they were infected. They should have antibody because they got monoclonal. And then I don't know if there might be some concerns around how they capture data or symptoms after vaccine. So you should wait 90 days. We'll clarify on IVIG. With other vaccines, you do have to wait to receive them before you receive IVIG in a lot of cases, and there's some variation on the time with that, depending on vaccines. So we will double check on that. And if you want to put your email in the chat, we can respond to you directly. So throw that in there if you don't mind. All right, that's all I've got. It's 12:59. We're going to let you go. Have a wonderful holiday. Happy Hanukkah. I know that ended yesterday. Merry Christmas if that's what you celebrate. And we will plan to see you after the first of the year on January 8th, but look for the Tennessee Health Alert Network communications that will start coming out to you all this afternoon. Have a great day. Thanks all.